next question would be, or what I would like to understand is, as you said, you are currently a advanced nurse practitioner. Okay, this practitioner word might be new for many people, or it might be a common term nowadays. But I understand that it is there are stages you have gone through to become a practitioner,
Yes.
advanced nurse practitioner,
Yeah.
and especially in particular specialization,
Yeah.
cardiac.
Yeah.
And as you said in before, there are different categories where you can become an advanced nurse practitioner in different. So I just want to know, from here they finish their nursing, BSc nursing or DNM or what are the different options or outcomes they have?
Yes.
Okay.
Yeah.
In UK or anywhere else in the world
Yes.
for a nurse to become. It's
Of
not
course,
just nurse.
yeah, yeah.
It's just not RN. That's I know.
No. So there are various ways you can progress in your career depending upon how your choices, your interest. You can go in the managerial line,
Great.
become a senior staff nurse, and then become a sister. That's what they say for the charge nurse. It's band 7 post. Or then you can become a matron, or you can become a head of nursing, deputy head of nursing, even a nursing director,
Right.
wherever you want to. That's the managerial section. If you are more interested in clinical section and want to move upwards, you can become a specialist nurse practitioner, advanced nurse practitioner, or you can even become a nurse consultant. You can manage clinics. You can, there are nurse consultants who work in like A&E, accident and emergency, that area, and they consult patients, patients. So like there are various ways you can move upwards in the clinical area. If you are interested in doing research, there are fields, research, you can become a research nurse and move in that area. In case you are interested in teaching, you can pursue that as well. There are in the hospital setting itself, there are teaching professionals who are there to support with the nurses who are already working to upgrade their level of knowledge. But instead, if you want to work in a university as a lecturer, or and then again you can grow up there as well. But there are lots of opportunities, and you can work as a nurse in general GP surgery as well. I don't know whether you are familiar with that term, but in the UK, we don't have these private hospitals here where if you get a fever you can just run into whichever hospital you have. But there we have in each area, we call that GP surgery, general practitioner surgery, or family doctor as they say in US. So you go there and then get your treatment from there. But if it's something that needs specialist attention or a hospital treatment, then the GP would refer that patient to the hospital. That's how you go to the hospital. Otherwise, unless it's an emergency case, you will not go to see a cardiologist in a hospital just like that, unless your GP had referred to.
Even if you want to.
Even if you want to.
Okay.
Yeah. Otherwise, the GP, the doctor should be your friend.
Okay. Fine. Okay.
Well, what I was going to say is, in the GP surgery, there are also nurses, specialist nurses, who see patients, do their own clinics. So there are various ways you can progress.
So what I understand, and I think it's beneficial for most of our viewers, that it's just not a nurse who is going to UK or anywhere.
No.
They have lot of different opportunities in their career.
Yes.
And yes, of course, it might take years, but that years really counts because you have experience in each area.
Yeah.
Okay.
And you need to study there as well. As I said, you can do modules in university. If you want to become a specialist in asthma, for example, you can do modules in university related to asthma care.
Okay.
And then if you're lucky, there comes a post for asthma specialist nurse and you apply. And because you have this background of training in that area, it might be easy for you to. So you do modules that are of your interest.
Yeah.
And then,
So it's a real Pandora box you have for a nurse, isn't it? Because as a layman, what I thought was a nurse is always a nurse till the end.
No, actually there is in the UK, I would say maybe 50% of the nurses would be on the floor. There are other maybe 50% working in like managerial levels or research, education, teaching specialists. There's a lot of opportunities for you to grow into. But of course, you should have that energy and enthusiasm within you.
That
and work hard.
Also,
and work hard.
Yeah, and determination also should be there.
Yes.